Thank you for joining us to discuss using Aquifer in the clinical phase. Aquifer cases walk learners comprehensively through each step of a patient encounter, from history, physical and labs, through developing a differential, ordering additional studies, forming a final diagnosis, then treating and managing the patient. Throughout this process, core content learning objectives are met through meticulously mapped teaching points, such that by the end of the course, all of the relevant national objectives have been covered. Cases provide in depth and engaging teaching along the way, much as you would expect from an expert preceptor, asking students questions to check and correct their knowledge before moving to the next step. Educators often share that they assign students cases containing topics normally covered during the didactic session. Classroom time then goes deeper into a topic, whether discussing different but related cases or discussing actual patient encounters related to aquifer cases. We know educators are busier than ever, which is why we've created the AI assistant chatbot. Educators often ask, how do I find the right cases? What's the best way to integrate them in the curriculum? The chatbot answers these questions instantly, no waiting for email replies or searching through documentation. Simply type your question in the text field, and the chatbot will recommend aquifer cases for your clinical rotation or course, provide strategies for using cases in small groups, flipped classrooms, or independent study, and help you plan a course with the right cases across your curriculum. We know there are circumstances in which educators want to have a greater ability to filter and retrieve case results. The content library provides advanced content searching across all cases and or integrated illness scripts that are aligned to your subscription. The detailed content list displays information including synopses, case summaries, learning objectives, and integrated illness script mechanism of disease maps with one click. The content library includes a series of drop-down filters, including clinical discipline, body system, patient age, location, clinical focus, and the aquifer content aligned to your subscription. You may also search by condition and diagnosis, basic sciences if your subscription aligns to that, as well as clinical excellence curricular threads should your subscription align to that. Aquifer cases and scripts are written and continuously updated by expert health profession educators who make up the Aquifer Consortium. The date the content was last updated are displayed for each item, so you can be sure your students are being provided up-to-date content written by your trusted peers. Consider using Course Builder to assemble your case and script choices into one package, or Course Builder. You can assign specific aquifer cases and scripts to students, track your class or cohort progress at a glance, and include course-specific information or directions for students. Save time by using our duplicate course feature, which allows you to copy content and or users to a new course. The QR code will take you to the webpage with more specific step-by-step details for creating Course Builder. One of the biggest challenges experienced by both faculty and students is time, especially in fast-paced clinical settings where experiences can vary widely. At one Northeast Research Medical School, Aquifer was used to address curricular gaps. Instead of adding a standalone geriatrics clerkship, faculty embedded Aquifer geriatric cases across existing clerkships to address known gaps in geriatric competencies. When learners struggled or were at risk of struggling, Aquifer cases provided a structured, competency aligned way to build foundational knowledge outside of clinic. This meant that by the time students arrived in clinical settings, they already understood key concepts, terminology, and clinical reasoning related to older adults. Faculty could then use precious in person time for higher value activities such as observation, skills practice, discussion, and feedback, rather than reteaching core content. More importantly, this approach also standardized remediation efforts across campuses and clinical sites. Every learner, regardless of location or patient mix, had access to the same high quality cases and expectations. In short, Aquifer functioned as a scalable remediation tool that helped learners get up to speed more quickly while preserving clinical time and reducing faculty burden. Clinical education isn't always predictable. Students may miss key patient encounters, fall short of required clinical hours, or need additional support to remediate specific gaps. At one California PA program, faculty identified these particular issues. Students who lacked exposure to certain conditions, settings, or patient populations, or who needed targeted remediation during clinical year rotations. Aquifer served as a bridge. Faculty were able to assign specific cases that aligned with what a student missed in the clinical environment. Using Aquifer's content library filters by system, condition, patient demographic, or clinical location, faculty could precisely match cases to individual learner needs. Students reported that working through Aquifer cases improved their confidence and made their subsequent in person encounters more meaningful. Faculty observed stronger clinical reasoning, better decision making, and improved readiness for real patients. During the clinical year, students are on different rotations. Faculty time is limited, and there's very little flexibility to bring everyone back together for additional instruction. At one Northeastern PA program, faculty use Aquifer as a practical solution for targeted remediation that fits into this fast paced environment. Gaps are identified either through an end of rotation exam feedback or through observed patterns in student performance, such as clinical reasoning errors in simulation or standardized patient encounters. Instead of redesigning sessions or rescheduling labs, faculty quickly select relevant Aquifer cases from the content library that directly address the identified gap. These cases are assigned asynchronously, allowing students to engage with the material on their own schedules. Finally, students complete the cases and may be asked to reflect, revise documentation, or retest shortly afterward. This closes the learning gap quickly and creates a clear documentation of both evaluation and remediation. This approach supports accreditation standards, ensuring remediation is objective, timely, and well documented without adding unnecessary burden to faculty or students. Orienting your students to Aquifer will make a big difference in their learning experience. You can help them maximize their learning by sharing some key information to help them get started and understand how Aquifer fits into your plans for your course or clerkship. We've created slides with the basics on Aquifer cases and useful tips for students ready to drop into your course or clerkship orientation. Using this QR code takes you right to the PowerPoint slide deck. We're excited to offer you a personalized session with an experienced health professions educator who actively uses Aquifer in a variety of learning environments with different levels of learners. Curricular consults can cover a range of teaching suggestions, integration strategies, and guidance. Each consultation will be customized to your specific needs, with the goal of getting you quickly up to speed and making the most of your subscription. Scheduling a consultation is quick and easy using this QR code, which takes you right to the scheduling page. We look forward to connecting with you soon and learning more about how we can best support your curricular needs.